Hi everybody, this is David Lee. I'm president of the Western States affiliate of the Heart Association, and we're here at Scientific Sessions in Anaheim, and we're excited to talk with Dr. Anis Dodd from the University of Utah and highlight some of his research that he's presenting here at the Scientific Sessions. Anis, tell us more.
It's a pleasure to be here, thank you. So the purpose of our study was to look at if we could detect plaque early in people who have diabetes. Plaque, as we know, is the cause of coronary artery disease for most people. So we looked at a very minimally invasive way to do that, which was a neck ultrasound, and looking at the thickness of the wall of the neck vessel, and comparing it to a more kind of intense study, which is a study of the coronary blood vessels themselves with a CT scan.
Okay.
And we wanted to look at in patients with diabetes who we know have an increased risk of having coronary artery disease, if there was any association or correlation between the thickness of the blood vessel of the neck and any kind of plaque they have in the blood vessels of the heart.
Okay.
And what we find is that even though it's a very easy and cheap test to take a look at the thickness of the blood vessel of the neck, there's really no interaction between that and the plaque that you can pick up with a proper test looking at the coronary vessels of your heart using a CT scan. So what we find is that this is most likely not a very useful test in this particular patient population.
Okay. So, and that's important so that the clinicians will have a better idea of what a more appropriate test is if they're looking for maybe the early signs of heart disease. Is that the implication of your study?
That's right. So I would urge clinicians to not use this ultrasound technique for the neck blood vessel to make any interpretation of their risk for having coronary artery disease.
So it helps makes us better clinicians, and it helps also direct the right sort of testing that should be done in patients with diabetes.
Absolutely.
Great.